Today's topic is all about sexual problems. What are sexual problems? Sexual problems are problems related to the sexual interactions between couples. Problems can occur during desire, arousal, or orgasm stages. Sexual problems are not rare. Approximately 20% of married couples and 30% of non-married couples have sexual contact than 10 times per year. Approximately 43% of women and 31% of men of all ages report having sexual problems. Sexual problems may be classified as physiological, psychological, and social in origin. Any given problem may involve all three categories. A physiological problem, for example, will produce psychological effects, and this may result in some social maladjustment. A physiological problem are the least among the three categories. Small number of people suffering from diseases due to the abnormal development of the genitalia or that part of the neurophysiology controlling sexual response. Vaginal infection, for example, retroverted uteri, prostatitis, or the inflammation of the prostate gland, and then adrenal tumors, diabetes, senile changes of the vagina, and cardiovascular problems.
So let's proceed to medical through surgery. Psychological problems comprised by four largest categories. They are usually caused by socially induced inhibitions, maladaptive attitudes, ignorance, and sexual myths held by society. An example of the latter is that belief that good mature sex must involve rapid erection, prolonged coitus, and simultaneous orgasm. Magazines, marriage books, and general sexual folklore often strengthen these ideals, which are not always achieved, therefore can give rise to the feeling of inadequacy, anxiety, and guilt. Such resulting emotions can definitely affect the behavior of an individual.
There are three types of common sexual problem for the young male. First is premature emissions of semen. Then second is erectile impotence. And the last one is the ejaculatory impotence. Premature emissions of semen. This is the one of the premature emissions of semen, in which is most common for the young males. It is because of the natural result of excessive tension in a male who has been sexually deprived. And the second is erectile impotence, and almost always a psychological problem in males under 40 years old and under cases. The impotence may be the result of disinterest in sexual partner, fatigue and distractions because of non-sexual warrants, intoxications, and other causes such as occasional emergency, and is common and requires to the repeat. And the last one is the ejaculatory impotence. The third one is the ejaculatory impotence, or the inability to ejaculate in coitus, and uncommon and usually of psychogenic origin. It is due to the past traumatic experiences, and occasional ejaculatory ability can be possibly affected or expected in older men or in any male who has exceeding his sexual capacity. And this is the three types of common sexual problem for the young men.
Common sexual problem for female is a vaginismus, or a strong spasm or contraction of the pelvic musculate muscle, constricting female reproductive organs so that penetration is painful or impossible. It can be due to anti-sexual conditioning or psychological trauma as an unconscious defense against coitus.
Medication of sexual problems. The first one is psychotherapy, and by gradually or deleting, widening the female organs with its increasing large cylinders. This is the topic or summary. The first one is classification, medication through surgery, and common sexual problems for young male, and common sexual problems for female. And the last one is medication.